Thank you so much. Great to see everybody. Thank you for joining us today to talk about this very hard-fought victory for survivors. It's the passage of key provisions of our Survivors Access to Supportive Care Act and what this will mean for survivors of sexual assault seeking care and justice. And I really want to thank Congresswoman Jayapal for years of hard work together on this issue. She's been such an important partner in Washington State and in Congress. And I especially want to thank Leah Griffin for speaking up and never giving up and fighting to protect others from the same awful experience that she had. Leah is a constituent of ours. More than 7 years ago, way back in 2014, she came to me and shared her experience of surviving sexual assault and then being turned away from a hospital when it was unable to administer a rape kit. Because the hospital failed to provide the care Leah needed, prosecutors then declined to file criminal charges in her case, and she was denied the justice that she deserved. You know, when I first heard Leah's story, I was so furious. I was determined to fix it. To me, it was just appalling that Leah and really so many survivors across the country like her went to get the care that they needed and were denied it, told to try elsewhere, ultimately denied justice, simply because a hospital lacked the training or resources on site to provide survivors the care they needed, including by administering rape kits. Survivors' health and ability to seek justice should be a priority in our healthcare system. Everyone should know that during an unimaginably traumatic time, they can get compassionate care from well-trained providers who know how to provide care to survivors specifically, who can administer critical forensic examinations and who understand how important these exams are in allowing survivors to seek justice under the law. That's why after hearing Leah's story, I got to work on legislation to help make sure survivors get the care they need to heal, and introduced our bill in 2016. And since then, Congresswoman Jayapal and I have been working the phones and reaching across the aisle and talking to our colleagues to build support for this critical legislation. We've worked with Senator Murkowski, and her partnership was invaluable in this. We've reintroduced this bill every Congress since. And just about a year ago, we held a press conference, not unlike this one, and urged Congress to take action. And I said at that press conference, I thought this was our year. Well, it was. This week, President Biden is signing the key components of our bill into law as part of the reauthorization of the Violence Against Women Act, or VAWA. These provisions are going to help survivors get the care they need and deserve by requiring the development of national standards of care for survivors of sexual assault and by strengthening the sexual assault forensic examiner workforce and expanding access to sexual assault forensic examination services. This is a huge accomplishment. It's been years in the making, and it's especially important now as I've heard stories from across our state that the staffing shortages in our hospitals continue to make it even more difficult now for survivors to access the care and forensic examinations that they need. So today we're making clear that a survivor's ability to get sexual assault forensic examinations and to receive compassionate, experienced care is an integral part of VAWA and a priority in our healthcare system, not an afterthought. And we're showing what's possible when Washington State voices like Leah's are heard here in DC. I'm so glad we're here today to talk about how these measures have been signed into law, and I'm deeply honored now to pass this over to Leah to share more about what this accomplishment means for survivors. Leah, thank you so much for speaking out originally. Thank you for hanging with us all these years. Thank you for making your voice heard, and on behalf of survivors in our state and nationwide. Thank you. Go ahead.
Thank you, Senator and Representative, for standing by me. I remember after my assault in 2014, I experienced really just an avalanche of systemic failures and started reaching out to every lawmaker that I thought would be able to make a difference. I sent hundreds of emails to state legislators, city council, county council. The first person to respond to me was Senator Patty Murray. And when I got into her office and I told my story, she didn't hesitate to first do the research, which I appreciate as a librarian, and then to act and to write a piece of legislation that's going to make a difference for a lot of survivors. I remember going to her in 2016 and saying, Senator, I want to pass this. We got to pass this. And she said, we will, and has stood by me through trips to DC, through years of challenge getting media attention on this issue. And it means so much to see a bill that started from just a normal person in Seattle doing their best to end up as part of VAWA. I get calls from survivors all the time who experience similar issues, survivors who wait for hours and hours in the ER, and they ask me what to do. And I don't have a great answer for them. But now I know that help is coming because we have appropriated money to train so many new sexual assault nurse examiners and really strengthen the SANE workforce. Thank you both so much for doing this with me, for standing by me, and for doing this for survivors and prioritizing us. I'll pass this over to Representative Jayapal.
Well, thank you so much, Leah. As Senator Murray said, we are just so inspired by you and the ability that you had to take what was an awful experience for you and turn it into an act of strength, courage, and resilience, something that will benefit so many people across this country. And Senator Murray, what a joy it is to work on a bill with you and to see your continued leadership on this, as in so many other things that you do. I think this is just a fabulous example of Washingtonians across the board making things happen in the United States Congress. I remember I was actually in the state Senate in 2016, and I remember we were working on bills around processing of rape kit backlogs. And that's really how I first came to this issue. And I, like Senator Murray, heard Leah testify on a panel that we had. A bipartisan group of us were working on passing legislation at the state level to address rape kit backlogs. And in the context of that, we heard all of the issues with the lack of services for lack of, the ability for people to get trained nurses, the lack of the processing of rape kits and the aftermath of sexual assault. And that's where I heard Leah speak. And I'm so proud that Leah is a constituent of mine as well. And I will tell you, there wasn't a day when Leah did not come in with another idea about how we were going to pass this bill. When I came to Congress, I was so thrilled to be invited in to this federal piece of legislation after having passed some really important state legislation. But the ability for somebody to share a personal story about seeking justice after surviving a sexual assault and turn it into an effort to get access to the healthcare services that so many people need, including a forensic exam, is truly the inspiration of this legislation and will benefit countless survivors during an extremely difficult time in their lives. I think the thing that always struck me in listening to Leah and listening to others as we worked on this legislation was this unacceptable gap in our medical resources and care, a gap that existed even before the pandemic exacerbated the need for supportive health services. And SASCA, the provisions that are in the Violence Against Women Act, will finally ensure that survivors of sexual assault can get the care that they need by closing these gaps and by providing $2 million per year in state level funding to better understand the gaps in care and services for providers, and then also seeking to address them altogether, developing national standards of care for survivors to ensure more equitable access across our country. And finally, SASCA will make it easier for healthcare providers to access training and provide better care to survivors by establishing a pilot program that expands exam training and services, as well as a new resource center to support access to examinations and encourage training for personnel. I'll just share with you that this morning I was speaking at the Democratic Municipal Officers Breakfast. And I was mentioning all the things we've gotten done. And of course, I had to put a plug in for this bill. And as I came off the stage, a number of municipal elected officials came up, and out of the entire speech, this is what they wanted to talk to me about and thank us for. So Senator Murray and Leah, thank you so much for the work that we have done together. And Leah, thank you for your incredible courage in making this happen, and your persistence and resilience in never giving up until we got it across the finish line. What a great, wonderful day this is for our entire country.